So Dr. Let me introduce Dr. Sacheti. We know Sacheti is a friend and a fierce independent leader who is keeping the independence of the physician in New Jersey, what Dr. Raj Bansal call it, a mafia. So it's a really great honor for me to introduce you, Dr. Sacheti. Please, Dr. Vinod, tell us about your place. Tell us about your tough time and then path to victory as an independent physician leader.
Yes, thank you, Subodh. Can you hear me?
Yes.
Yes, thank you, Subodh, for allowing me to talk about New Jersey ACO. And we started New Jersey ACO 6 years ago. And last 3 years from 2017, 18, and 19. In 2019, we received a shared saving check of 5.1 million on behalf of New Jersey ACO and all providers. And we have blessing from Palm Beach ACO with Dr. Raj Bansal, who is our management company, and Dr. Rohit Dandiya, he's medical director of Palm Beach ACO, who gave us insight on monthly basis what to do and which direction we are to gear our ACO for success. So now we are in 6th year of ACO. Now we have risk-based ACO for 2020, and hopefully we'll be able to get the shared saving again on 2020. So I'm very thankful to all the leaders all across, which has been managed by Palm Beach ACO, including Doctors ACO, New Jersey ACO. We're trying to get another ACO from New York to get into our ACO too. So I'm going to introduce, I think, Dr. Rohit Dandiya, who is one of the founder of Palm Beach ACO, as well as medical director for Palm Beach ACO, as well as he's our main liaison person in Palm Beach ACO to give you the right direction for our success of New Jersey ACO. Rohit, go ahead now.
Okay, so we'll skip this, you know who I am and what I do. And now I know you've had a long day and many, many graphs, much data, Excel spreadsheet, excellent spreadsheets. I just have one graph. The rest is easy, homey stuff that will not challenge you. It's going to wrap up everything. It's kind of where the rubber hits the road. So as they say, just relax and enjoy the show. Next slide, please. So why are we doing all this? What is this all about? I mean, it's not just that ACO has to save money, ACO has to do this, and we save money and we increase quality. It really is because we are in trouble, guys. The country is in trouble. Look at these numbers. The graph that I show you with the bars shows you the Medicare expenses. We are spending about 700 billion now, and in 8 years, we'll be spending $1.27 trillion. Not many countries actually have their GDP, $1.27 trillion. This is an astounding sum. So something has to be done about it. At this time, Medicare is taking away 3.7% of the GDP. If we go to the graph unfettered, if it keeps going like that, our GDP for Medicare itself will be 16%. Now, if you look to the right, you'll see our total GDP that we spend on Medicare is 17%. That means for every $100 we earn, we spend 17 on Medicare, on healthcare. Now look at the next country. Switzerland is 12%, Japan is 11%, and England right at the bottom, United Kingdom is 9.8%. So we are really wasting a lot of money, and our longevity does not justify the expenditure. I was looking at the data, we're about 30 down from the top longevity in the world. So something has to be done. And that is why Medicare, in their good judgment, created ACOs. And I think we are making a dent, a small dent, but nevertheless a dent that is important. And as the ACO word spreads, I think our dent, our importance, and our effectiveness will get more and more. Next slide, please. So I'm an internist. I'm not going to give you too many numbers and graphs because I'm not even that good at that. So what is happening? What is happening is that we are shifting from fee for service, not another day, another dollar. It's sort of still another day, another dollar, but for another day, another dollar, there have to be questions that are answered, thoughts that we have to give and create a more effective plan. Improve patient outcomes. And this will help sustain the Medicare Trust Fund. How are we going to do that? We've discussed that many, many times by excellent discussions earlier. So I'll skip this one, but I'll go to the next slide, please. Okay, first and foremost is the preventive visits. Very, very important, simple, but a powerful tool. Annual wellness visit. It's not stylish. It's not a big cardiac cath. There's nothing fantastic about it, except that it's a fantastic modality. Annual wellness visit is a very important modality. Number one, it keeps you in touch with your patient, addresses issues that we don't address when a patient comes for a sick visit or a hypertension visit. We address various issues as listed in the second line. We discuss preventative screening, immunizations, all other GPRO related issues which help your quality. The focus of a medical wellness visit is not exam really. It's more about talking about the patient, taking an interest in the patient's social history and creating a plan for the patient. So you have to do your medical wellness visits. I'm told that each medical wellness visit brings in good revenue, but more importantly, improves your care. So guys, do medical wellness visit. If you are very busy, there is still some time left. Seek the help of your physician assistant. Maybe open your office for the weekend and just wrap it up and take care of it, please. I cannot overemphasize annual wellness visits. Next one, please. Okay, the other is increase access to care. If you don't give access to care, where will the patient end up? He'll go to his neighborhood-friendly ER, where everything that you can do in the office for $100 can cost a couple of $1,000s. And then there is, of course, the risk of being admitted in the hospital, which has a trickle-down effect in everything, as we'll discuss a little later. These are all simple ideas which have probably been told and discussed with you, but I'll just re-emphasize them because I think they're very important. And as I said, this is where the rubber hits the road. Keep same-day slots. Not only keep same-day slots, because a lot of patients think that, oh my God, my doctor is so busy. If I call him, he won't be able to see me because he's such a popular doctor. No, you have to keep same-day slots. Not only that, you have to let your patients know. What we have done in Palm Beach County, we have made a poster where we put a poster in the waiting room. Look, we have same-day slots available. Don't go to the ER unless you call us. Increase your office hours if it's possible. You know, you don't have to do it every day. A couple of days a week, perhaps. Maybe one day a week for working folks and for folks who just cannot come during the day or need someone to bring them. Do that, please. The third is a very important thing that we do here at local hospitals. We have talked to our local emergency room, and I've had many discussions with them to say why they cannot discharge patients home. And of course, there are some patients who just absolutely must be admitted. Some patients with sprain or a cut have to be sent home. There's a small gray zone of patients that can be sent home. So the ER physician told me that, look, we are not sure that the patient will follow up with you. So we have assured them that if you send a patient to our office the next day at a certain pre-assigned time, we will see them. Text us and we'll see the patient the next day. That gives them assurance, prevents an unnecessary admission, and lets you take care of your patient. So for those who are interested in exactly how we do it, I'm happy to discuss this with you one-on-one, but a next day visit at the office is a very important tool to prevent your patient from having an unnecessary admission. Closed loop system, never let a patient go home without a future appointment, because if you don't give a future appointment, you never know when the patient will come back, where he'll end up. He may run out of his medication and such. Next, do not put your phone call for your office on service for lunch. You have to be able to take all calls, because if your office is closed for 2 hours, that's 1/4 of the day gone closed. 25% of your patients, when they call, cannot be seen. So guys, please don't put yourself on service for the 2 hours. Keep yourself open. Your staff will resist it. You have to put them on rotation and have some kind of an incentive to do that. Next, please. Again, it's all about preventing unnecessary ER visits. Your patient goes to the ER, he is kind of like in a lion's den. You go to the ER, and ER is very subjective. We have two hospitals here. One hospital, 56% of all the patients who end up at that ER are admitted. Another hospital down the street, down the street, 10 miles away, only 38% of the patients who are admitted, who come to the ER are admitted. So there's a lot of subjectivity in this matter. So if you can somehow prevent your patients from going to the ER, I think you've won the game. This is central to taking care of and saving cost and increasing quality. You go to the ER physician wants to admit, that is his basis, that is his bias, that's probably how he gets a bonus. And then the whole cascade starts, including hospitalization, perhaps excessive treatment, and who knows what. So please also educate your patient. Someone said so rightly, tell the patient, guy, if you can drive to the ER, you can call me first. That's a very simple way of preventing a patient from going to the ER. And of course, when the patient calls you, you have to be available. Urgent care is a very, very strong modality that we should use, but we do not. Be friendly with your urgent care center. Have a relationship with them. Ask your patient to be aware of where their urgent care center is. Because when a patient is bleeding or having shortness of breath or having diarrhea, that's not the time to look for your friendly urgent care center. They need to know that before. On the right side, I'm not going to bore you with details. The red cost is the cost of the ER, and the green cost is the cost of going to an urgent care center. I was listening with great interest to Dr. Plaster. Going to house calls are a very powerful tool that will give you so much information. I have done house calls. You get about $200 for them, but that's not the only thing. You know so much more about the patient when you go to their office, to their home. Now, I'll tell you a classic story. I had a patient, old couple. One had hypothyroidism, the other had hypertension. I just could not control them, their hypothyroidism or the blood pressure, so I made a house call. Now, a lot of old folks sleep in separate rooms. What I discovered was the patient had switched the rooms, but not switched their medications. So on the bedside, they were still taking the husband was taking the wife's medication, and the wife was taking husband's medication. Now, this may sound funny, but it has a lot of negative effects. So I'm not saying to do house calls on you have to do it in a practical manner. But I believe house call is a very important modality that we should use. And as Derek says, a phone call to a patient also does a lot more than just a phone call. It just sends patient raptures. It makes them very happy. They can't stop talking about it. And of course, it provides them a direct contact with you. So patients who are sick, who are frail, please pick up the phone and call them. And especially get a list from your care tracker, who your expensive patients are, who your frequent flyers are, and give them a call. One other thing we have done is that, patients have this fear of calling the doctor's office and getting stuck and not getting through the office. And what we did in our practice was, I got a cell phone, I gave it to one employee every month. And for the top sick patients, frequent flyers, frail, bad COPD, CHF being readmitted to the hospital, we gave them this cell phone number and told them, look, you have a problem, you call this number anytime. It really helped us. The patients did not misuse it. They did not use it for refilling their prescriptions. It's a very simple method that you may consider using. Of course, you have to see your patient frequently, and your sick patients, frequent flyers, please get in touch with them on Wednesday. Make sure they're doing okay, their weight is stable, they have their medications, and they're feeling all right. I have done all this, it does work. Next slide, please. Transition care, I can't emphasize that enough. Medicare, in their good wisdom, I think they're going in the right direction. Realize that transition of care, and this, once a patient is discharged, he's okay, but that's when the confusion starts. The patient doesn't know if he's to take his old medications or the new medications. Maybe they're not talking to each other about which medication to take, so they decide just what to take. Please see your patients within 7 days. Medicare pays almost $240 for that visit. But most importantly, the more transition of care that you do, the less admissions that you your patients will have. We have seen that. We've done research at Palm Beach ACO. More transition of care, less hospital admissions, less readmissions. Next slide, please. Okay, we call this the Super Doc app. Other ACOs call them Care Tracker. That has been discussed, and so I won't discuss it anymore. We have seen our doctors, those who use the app or the Care Tracker, the more they use it, the less admissions they have. In fact, we've started a new program where if they enact upon their messages, we give them $4 for taking care of a message that we send. Now, $4 is not big sum itself, but if for a busy practice, it adds up to $300-400 a month. I mean, you can do a lot for $300-400 a month, and especially if your employee is taking care of your messages, and if you share that money with the employee, I think it'll go a long way. And please schedule your annual visits. I think this is my last slide. The year is coming to an end, but our work is not coming to an end. We still have 4 weeks of good work left. Please do not give up. Please keep doing all the things that you've been assigned to do, advised to do, and you know. So what you do in this end, maybe the straw that will not break the camel's back. Thank you very much. Thank you for listening to me. Good day and happy holidays.